Well, my name is Alexandro Lucian. I'm president of Direta. Direta is a non-governmental, non-profit organization which represents consumers of vaping products in Brazil. And I'm here to talk about the health hazards of vaping disinformation and misinformation. Well, I think we have to start by definition of misinformation and disinformation. According to the American Psychological Association, we have misinformation is the false or inaccurate information, is plain and simple, just getting the facts wrong. But disinformation is when people know what they're doing and know what they are talking about, but they intentionally mislead the public or someone else. According to this organization, the spread of misinformation and disinformation has affected our ability to improve public health, address climate change, and maintain a stable democracy, and more. And unfortunately, these two words happened very often in Brazil, because we have two very different scenarios. When Brazilian health organizations and the press tell people about electronic cigarettes, they say electronic cigarettes must be banned. Vaping is the same or worse than smoking. Vaping has more nicotine than conventional cigarettes, which is absolutely contrary of what several international health organizations are saying. Like electronic cigarettes must be regulated. Vaping is 95% less harmful than smoking. Vape is less addictive than conventional cigarettes. So who supports vaping in Brazil? Actually, the consumers. We think that Brazil has a prevalence of smoking of about 10 to 12%, which appears low, but when you compare to France, the 10% in Brazil is exactly the same of 35% of prevalence smoking in France. When you say about consumers in Brazil, we already have 2.2 million frequent users of vaping devices. 5.9 million smokers already tried vaping. So in Brazil, as a big country, any 1% is a lot. We have also some health professionals better informed about tobacco harm reduction who support vaping. We have few independent organizations like Direta.org, which is the organization that I am the president. And we also have some illegal vaping sellers and brands who wants to become legal. So right now it's a paradoxical scenario. There are people that are against the law selling vaping products, but they try to do the right thing, like don't sell to minors, don't sell to non-smokers, don't sell counterfeit products. The majority of them are ex-smokers and now vapers, but unfortunately they are illegal as much as the ones that are selling to minors and fake products. And now also we have the tobacco industry supporting regulation on vaping by their own interests. And we have people against vaping. Who are those who are against regulation of vaping? We have several private organizations call themselves health organizations. Several of them have cancer in the name, so it's a Foundation of Cancer, Institute National of Cancer. And those organizations, the problem, I think the main problem is the misinformation regarding the message like this. For instance, this is a picture, is a frame from a video which is being broadcast in social media and also on national television in Brazil, which is not cheap to get an advertise like that in national television, saying that one vape is equal to 100 cigarettes. There is no whatsoever scientific proof to support this claim. This campaign is being paid by a cancer institute. The organization receives funding from Bloomberg, no surprises there, and it's working because I have several people coming to me and telling me that their friends and co-workers are worried about their consumption of vaping products, and they are asking those consumers to stop or even go back to smoking because it's the lesser evil. And the problem is the credibility goes a long way because these private organizations, health organizations, are well known in Brazil, and they are already done great work in other areas like COVID and nutrition and food, so too much processed food. So the argument of authority here is often used. I'm a doctor, I'm a specialist, so I know what I'm saying. Believe me, but no sources or scientific papers are presented. And very few health professionals goes against this narrative because there are some backlash when they try to talk about tobacco harm reduction. We have cases of people get uninvited to events in Congress because they are talking about THR. The majority of doctors in Brazil thinks that nicotine causes cancer. This is a phenomenon that doesn't happen only in Brazil. We have America and Europe, several health professionals think that. It's worse when they talk about vaping. They exaggerate risks, minimize benefits, say things like gateway to smoking, and present studies out of context and with no comparison with smoking. And of course, this is shown by the media. We have headlines like electronic cigarettes bring similar or worse health harms than regular cigarettes, and so on. I'm moving a little faster because of our time. So please, if Monica, if I'm talking too fast, tell me, and I'll try to slow my pace.
No, you're doing great.
It's not surprised that 8 out of 10 people are in favor of a ban on vape in Brazil. This is a very short amount, small amounts of interviews, but 8 out of 10 in a recent study. So how do we respond to that? Me as a tobacco harm reduction researcher, few organizations, we ask legislators to make Brazil follow decisions from countries like England, Canada, Sweden, and many others. They are good examples of public health policies. We show demographic numbers of real-world societies and the results of their legislation towards THR, like Sweden, 25% less smoking the last 10 years, minus 44% that's linked to smoking, minus 41 less cancer rates. We present reports and peer-reviewed science like Cochrane, Royal College of London, and etc., showing that vaping is a gateway out of smoking, like Dr. Maria Glover showed us. New Zealand is a case of that. People are getting rid of cigarettes and start using vaping. So it's clearly a trade of products. We alert that vaping is not without risks, but it's safer than smoking. And in conclusion, for an adult smoker who can't or don't want to quit smoking, vaping can be a good alternative to reduce harm. But then it came the shield gambit fallacy. It's absurd, it's funny, but it's sad. This is a real thing. The shield gambit is one type of ad hominem argument where one side dismisses the other arguments by alleging that they must be on the payroll of some agency to make the arguments they are making. This is commonly used by flat earthers. You say the earth is a sphere, they ask how much NASA is paying you. This happens all the time in Brazil. If I go to a podcast, I'm not a doctor, but the past 8 years, I study about the tobacco harm reduction, and they say, who is paying me to say those things? It's absurd, but it happens all the time. The results, people who don't want or can't quit smoking will continue to smoke instead of trying out an alternative method like vaping. It will be difficult to pass a legislation permitting the sales of vaping devices. People won't use vape as a gateway out of smoking. The number of diseases and deaths of smoking will continue in Brazil. And we have other statistics that say around 4,400 people die daily in Brazil from diseases linked to smoking. So we have another big problem. Not only we lose the possibility to present a less harmful alternative to smoking, but in Brazil, the only way to buy a vaping devices is by illegal markets. This market doesn't care about for who they are selling, if the person is a non-smoker or even an underage possible consumer. There is no safety standards, no quality of control, especially with substances being consumed. A big risk of contamination, like a valley. A valley was not linked to liquids exclusively with nicotine, but in United States, THC, there is a big market of a legal market of THC cartridges. EVALI was a contamination fruit of false products, fake products. And this offer of fake products is a bigger profit margin for the seller in Brazil. So we have a very big risk of contamination. That is my main concern of everything that I'm saying to you. It's my main fear. And sellers don't know what they are offering. They can offer a high concentration of nicotine with high-powered devices, which leads to risks of overdose and use of products outside their intended use, like recharging disposable devices. This is basically what's happening in Brazil. But I want to end with a positive note. What is the solution? I think science can't be ignored forever. I think initiatives like SCOHRE helps to bring proper scientific information about THR to everyone in the world. I thank you very much for the organization, to Monica, so I can be here and learn from you mostly and try to give information and to contribute to this initiative. We must continue to share unbiased and technical information, and despite the challenges, we are on the side of the science. I think our goal is to prevent diseases and deaths linked to smoking. It's a noble goal. It's not easy, but I think it's worth it. So that's it, what I have to say. Thank you very much. If you have any questions or want to get in contact with me, please use info@direta.org.